Chronic fatigue syndrome, managing symptoms, and planning for a healthy lifestyle. Chronic fatigue syndrome is a multifaceted disease with symptoms that may include pain, brain fog, joint pain, and muscle pain, to name a few. The most common symptom is extreme fatigue and inactivity. Unfortunately, there is no known cure for chronic fatigue syndrome. There are treatments that can help manage symptoms, such as treating the symptoms of pain, sleep, and neurocognitive function with medications. Chronic fatigue syndrome affects more women than men, and is most often seen in people in their 20s and 30s. This means that people with this disease are a prime target for fertility issues. However, there is hope. This video will discuss the symptoms of chronic fatigue syndrome and treatments that can help. Before we go into the main discussion in this video, don't forget to subscribe to our channel and hit the bell icon to get notified for more awesome videos like this if this is your first time on this channel. 1. Symptoms of chronic fatigue syndrome. The symptoms of chronic fatigue syndrome are both physical and mental. The physical symptoms include low energy, lack of motivation, irregular heartbeat, and extreme fatigue. The mental symptoms include confusion, forgetfulness, and a feeling of being overwhelmed. The symptoms of chronic fatigue syndrome can be managed by taking a break from work, using smaller doses of medication, and exercising regularly. It is also important to plan for a healthy lifestyle. This means thinking about what lifestyle changes you can make that will help you manage your symptoms. You should also take care of your mental health. If you feel like you are not coping well with your symptoms, you should talk to your doctor. 2. Treatment of chronic fatigue syndrome. There are several treatments for chronic fatigue syndrome. This includes cognitive behavioral therapy, exercise, and medication. These treatments are often combined with one another in order to make the best possible treatment plan for the individual. There are also some homeopathic treatments that are available. These include vitamins and supplements. Some other treatment of chronic fatigue syndrome can include psychotherapy, vocational rehabilitation, support groups, exercise, medications, nutritional supplements, sleep hygiene, stress management, mindfulness, biofeedback, naltrexone, decycloserine, antidepressants, anticonvulsants, antipsychotics, antiparkinsonian drugs, anti-anxiety medications, anti-epileptic medications, anticonvulsants. 3. The common symptoms between fibromyalgia and chronic fatigue syndrome. Fibromyalgia and chronic fatigue syndrome are often misdiagnosed as other conditions such as depression and anxiety. Chronic fatigue syndrome and fibromyalgia are both disorders that cause extreme fatigue and pain and can lead to other conditions such as depression, seizures, and anxiety. These disorders can also be caused by other factors, such as alcohol abuse, post-traumatic stress disorder, or viral infections. If you are experiencing any of these symptoms, it is important to get a proper diagnosis and treatment. 4. CFS recovery time. Recovery from CFS is more common than assumed, with 40% of CFS patients reporting symptom improvement after several years. Longitudinal studies have shown that 17 to 64% of CFS patients with longer than 6 months of illness improved, less than 10% fully recovered, and another 10 to 20% worsens during follow-up. Conclusion. Chronic fatigue syndrome is something you should address quickly in order for it not to get more severe as it is. See your doctor and get advice on how to go about tackling chronic fatigue syndrome. Thank you for watching this video. Don't forget to subscribe and click on the bell icon for more awesome videos like this.